SOMED, Cervical Cancer Prevention Awareness and Health Matters. Your partner in health matters. Dedicated to promoting awareness of both male and female issues.
Hello everyone and welcome to my channel. In my last video, I started the discussion on cervical sample collection for smear or pap test. For some of my viewers who have had or about to have a smear or pap test, I will be telling you the processes these samples go through in the laboratories and the test results received or you will be receiving. It is particularly important that women understand the report from the pap test and the significance of having regular screening tests. Cervical smear samples, when received in the laboratories, are processed using two methods, the conventional method and liquid-based method. Some developed countries, like the United Kingdom, have discontinued the use of conventional method. When conventional protocol is applied, the smear sample collected from the cervix is transferred directly on a microscope slide, whereas such samples are transferred onto a vial that contains preservative for liquid-based protocol. The vial sample goes through a processor in the laboratory, and the cells in the vial are also transferred onto a microscope slide. The slides are stained using Pap method regardless of whatever protocol to be used for analyzing the smear. The stained slides are examined under the microscope by a cytologist for the presence of infectious agents and cellular abnormalities. The abnormalities are graded according to severity, and the grade will also determine the management of the patient. Cytologists can dictate the presence of infectious agents in a pap test. Such organisms include Candida, a fungal infection that is generally common and are typically marked by an itchy rash that looks like a cluster of tiny red pimples. Trichomonas are protozoas that are often seen in smears and sexually transmitted infection. Infection of this organism is characterized by abnormal thick yellow-green vaginal discharge, which may also have an unpleasant fishy smell. Herpes virus is also sexually transmitted and can be seen in cervical smears if present. Herpes infection is characterized with open sores around the genitals with burning or itching sensation that is accompanied with unusual vaginal discharge. Actinomyces are bacteria found in smears of women with IUD. Its presence should prompt removal of intrauterine devices. The cells in the smear will be analyzed for cellular irregularities, and the scale of abnormality is graded cytologically. Smear reports sent to women will include any infectious agent detected plus cellular abnormality grade present and action recommended for management of the patient. If the result is unsatisfactory due to cells being scanty or obscured by blood or inflammatory cells, the test will need to be repeated in about 6 months. The delay before repeating the test is to enable the epithelium scraped earlier to grow back before sampling again. A negative result means no abnormal cells were seen during the test, so the woman needs to repeat the test in 3 or 5 years. If a low-grade lesion or borderline or mild is reported, the test will be repeated in 6 months for possible regression of HPV or to give the body's immune system a chance to clear off the HPV infection. If a high-grade lesion or moderate or severe are diagnosed, urgent referral to colposcopy for further investigation and treatment is recommended because such lesions have tendency of progression to cancer. Cervical cytology continues to evolve as another innovation is introduced to enhance accuracy of cytologists reporting on liquid-based protocol. Triaging with HPV testing was incorporated into the program and this is when all low-grade cytology reported smears are tested for high-risk HPV. So depending on the protocol used for analysis, smear reports will have high-risk HPV positive or negative. Cases positive for high-risk HPV are referred to colposcopy for further investigation and treatment. The accuracy or sensitivity of the screening program is not 100%, as there is the possibility of some abnormal cells being missed. A test result could express that cells are normal or negative for abnormality, when in fact there are presence of some abnormal cells that could develop into cancer. This is a false negative result, and for this reason, it is so important to go for regular screening tests, as any missed abnormal cell could be picked up in the next smear test. Some developed countries have changed the narrative of cytology as primary tool for smear tests and have adopted molecular technique using high-risk HPV testing. In this protocol, all smear samples are primarily tested for high-risk HPV. Samples that are HPV positive will have cytology review, while all samples that are negative for high-risk HPV will be reported as negative for abnormal cells. Vaccinated females are also on the screening program, and if samples from this group yield positive high-risk HPV results, a further molecular test will be carried out to identify biomarkers that could confirm neoplastic potential of the HPV subtype. Some options to treat or remove precancerous cells include large loop excision of transformation zone (LETs) and cone biopsy. Treatment of cervical cancer depends on stage of the cancer. The stage of the disease is referred to its size and whether it has spread beyond the area of the body where it first started. There are 4 basic stages for cervical cancer. In stage 1, the cancer cells are only within the cervix. Stage 2 of the disease is when cancer has spread into the upper part of the vagina or the tissue next to the cervix. During stage 3, the cancer has spread to the lower part of the vagina or the tissues at the sides of the pelvic area. Stage 4 of the disease is when the cancer has spread to the bladder or bowel or beyond the pelvic area to the lungs, liver, or bone. Multidisciplinary team of different specialists work together to make decisions about the best way to proceed with treatment of cervical cancer. This disease is often curable if it is diagnosed at an early stage. When cervical cancer is not curable, palliative care is offered to slow the cancer progression, prolong lifespan, and relieve any associated symptoms, such as pain and vaginal bleeding. The world is a global village, and all the protocols I have discussed are operational in different parts of the world. So, wherever you are, if you need to have a smear test, you will be conversant with whatever protocol the provider is adopting. Remember, knowledge is power, and cervical cancer is treatable if diagnosed early. Your lifetime risk of cervical cancer will depend on your individual life choice and situation. Thanks for watching, and please like and share this video with your friends and family, and I will see you soon.